Hello guys! Today I will discuss about the clinical pharmacology of the antihelminthic drugs. So what are the helminths? These are worms or multicellular organisms that infect very large numbers of humans and cause a broad range of diseases. These infecting organisms are classified as roundworms or nematodes, flukes or trematodes, and the last will be tapeworms or cestodes. These are the examples of flukes or trematodes: Schistosoma mansonmani, Schistosoma japonicum, Clonorchis sinensis or the liver fluke, Paragonimus westermani, lung fluke, Fasciola hepatica, known as sheaf liver fluke. These are the tapeworms or cestodes: Taenia saginata or the beef tapeworm, Taenia solium or the pork tapeworm, and the last will be Diphyllobotrium latum, fish tapeworms. This presentation provides a guide to the drug of choice and alternative drugs for each infection. These are the antihelminthic drugs available: mebendazole, albendazole, pyrantel palmate, piperazine, diethyl carbamazine citrate, ivermectin, niclosamide, and praziquantel. The first antihelminthic drug will be mebendazole. It is a synthetic benzimidazole derivative. Its action is for roundworm, hookworm, and enterobius, but it is less effective for strongyloides and trichuris. It is also effective for tapeworms. Its mechanism of action is slow. It takes 2 to 3 days to develop. It blocks glucose uptake in the parasite and depletion of glycogen store. The site of action is microtubular protein or the beta tubulin, which inhibits polymerization. The next drug will be albendazole. It is comparable efficacy with mebendazole for roundworm, hookworm, and enterobius. Albendazole is a broad-spectrum oral antihelminthic. It is a drug. The pharmacokinetics of albendazole: its oral absorption enhances by the fatty mills, and then rapidly undergoes first fast metabolism in the liver to the active metabolite known as albendazole sulfoxide. Albendazole metabolites are excreted in the urine. Albendazole is administered on an empty stomach when used against intraluminal parasites, but with a fatty meal when used against tissue parasites. It is a drug of choice and is approved in the USA for the treatment of hydatid disease and cysticercosis. It is also used in the treatment of pinworm and hookworm infections, ascariasis, trichuriasis, and strongyloides. But it is less effective against trichuris, but more effective against strongyloides. The next drug will be pyrantel palmate. It is also a broad-spectrum antihelminthic drug, which is highly effective for the treatment of pinworm, ascaris, and Trichostrongylus orientalis infections. It is moderately effective against both species of hookworm. However, it is not effective in trichuriasis and strongyloidiasis. Oxantel pamoate, an analog of Pyrantel not available in the USA, has been used successfully in the treatment of trichuriasis. These two drugs have been combined for their broad-spectrum antihelminthic activity. Pyrantel pamoate is poorly absorbed from the gastrointestinal tract and active mainly against luminal organisms. This is effective against mature and immature forms of susceptible helminths within the intestinal tract, but not against migratory stage in the tissues or against ova. This drug is neuromuscular blocking agent that causes release of acetylcholine and inhibition of cholinesterase, which results in paralysis of worms followed by expulsion. The clinical uses of pyrantel pamoate. For ascariasis, a single dose yields cure rates of 85 to 100%. Treatment should be repeated if eggs are found 2 weeks after treatment. For hookworm infections, a single dose is effective against light infections. But for heavy infections, especially with Necator americanus, a 3-day course is necessary to achieve 90% cure rates. A course of treatment can be repeated in 2 weeks. The adverse effects are infrequent, mild, and transient. They may include nausea, vomiting, diarrhea, abdominal cramps, dizziness, drowsiness, headache, insomnia, rash, fever, and weakness. Pyrantel should not be used with caution in patients with liver dysfunction. The next drug will be piperazine. Piperazine is an alternative for the treatment of ascariasis, with cure rates over 90% when taken for 2 days. But it is not recommended for other helminth infections. Piperazine is available as the hexahydrate and as a variety of salts. It is readily absorbed and maximum plasma levels are reached in 2 to 4 hours. Piperazine causes paralysis of ascaris by blocking acetylcholine at the myoneural junction. Worms are expelled by peristalsis. For ascariasis, the dosage of piperazine is 75 mg per kilogram orally once daily for 2 days. For heavy infections, treatment should be continued for 3 to 4 days or repeated after 1 week. The next drug will be levamisole and tetramycin. This is effective against any nematodes, but restricted to ascariasis. The mechanism of action is inhibition of fumarate reductase enzyme carbohydrate metabolism interfered, and the tonic paralysis of worms, and expulsion of live worms by stimulating ganglia of worms. The next antihelminthic drug will be diethyl carbamazine citrate. This is a drug of choice in the treatment of filariasis and tropical eosinophilia. It has been replaced by ivermectin for the treatment of onchocerciasis. The drug is rapidly equilibrates with all tissues except fat. It is excreted principally in the urine as unchanged drug and the N-oxide metabolite. Dosage should be reduced in patients with renal failure. Diethyl carbamazine immobilizes microfilariae and alters their surface structure. displacing them from tissues and making them more susceptible to destruction by host defense mechanism. The mode of action against adult worm is unknown. The next drug will be ivermectin. Ivermectin is the drug of choice in strongyloidiasis and onchocerciasis. It is also an alternative drug for a number of other helminthic infections. Ivermectin is a semi-synthetic microcyclic lactone derived from the soil Actinomyces. Streptomyces avermitilis is a mixture of ivermectin B1A and B1B. Ivermectin is available only for oral administration in humans. The drug is rapidly absorbed, reaching maximum plasma concentrations 4 hours after a 12 mg dose. Ivermectin appears to paralyze nematodes and arthropods by intensifying gamma-aminobutyric acid-mediated transmission of signals in peripheral nerves. In onchocerciasis, ivermectin is microfilaricidal. It does not effectively kill adult worms but blocks the release of microfilariae for some months after therapy. The clinical uses of ivermectin. For onchocerciasis, treatment is with a single oral dose of ivermectin, 150 microgram per kilogram, with water on an empty stomach. For strongyloidiasis, treatment consists of 200 microgram per kilogram once daily for 2 days. Niclosamide will be the next drug. Niclosamide is a second-line drug for the treatment of most tapeworm infections, but it is not available in the USA. Niclosamide is salicylamide derivative. It appears to be minimally absorbed from the gastrointestinal tract. The clinical use of niclosamide. The adult dose of niclosamide is 2 grams once given in the morning on an empty stomach. The tablets must be chewed thoroughly and then swallowed with water. Next will be praziquantel. Praziquantel is effective in the treatment of schistosome infections of all species and most other trematode and cestode infections. The drug's safety and effectiveness as a single oral dose have also made it useful in mass treatment of several infections. Praziquantel is a synthetic isoquinoline pyrazine derivative. It is rapidly absorbed with a bioavailability of about 80% after oral administration. Praziquantel appears to increase the permeability of trematode and cestode cell membranes to calcium, resulting in paralysis, dislodgement, and death. The clinical uses of praziquantel. Praziquantel tablets are taken with liquid after a meal. They should be swallowed without chewing because their bitter taste can induce retching and vomiting. For schistomiasis, praziquantel is the drug of choice for all forms of schistomiasis. The dosage is 2 mg per kilogram per dose. And that's all for antihelminthic drugs. I hope you guys enjoyed the video presentation. Thank you and have a great day.